Knock, knock, can I come in?
Yep.
Hi, I'm Valerie. I'm washing my hands. I'm going to close the curtain for some privacy. Can you tell me your name and your birthday, please?
Sure. Joe W. 1299.
Thank you, Joe. All right, so what we're going to do today is I'm going to check some of your nerves, your eyes, your mouth. I'm going to inspect all of that.
Okay.
Before we get started, are you having any pain or discomfort? Okay. So patient is alert, sitting upright, no signs of distress, no overt skin color changes, grooming and hygiene are intact. And I'm gonna just check your pulse here. I'm gonna hold your hand up here, right up here. For the sake of the video, I'm gonna do it for 30 seconds and times it by 2. Your expected heart rate is between 60 and 100 beats per minute, and your respiratory rate is between 12 and 20 breaths per minute. Okay, so do you wear any glasses or contacts?
Nope.
Any change in your vision?
Nope.
Okay, any new physical changes that you're concerned with?
No.
Okay. So patient is alert. And do you know where you are?
Yes.
Where are you?
Doctors.
You're at the doctor's? Okay, do you know what day it is?
Yes.
What day is it?
Today's Wednesday.
Okay, and what time is it?
It is 8:30.
Okay. So patient is oriented to self, place, and time. And I'm going to check your cranial nerves. So I'm going to jump right in and check your olfactory nerve sensory. I'm going to first have you just kind of hold one of your nostrils and blow, and then we'll do the same on the other side. Okay, so your latency is bilateral, both nares. And then I'm going to just have you smell the scent.
Okay.
So just close your eyes for me and tell me if you can smell this.
Yeah.
What is it?
Cinnamon?
Yep. Okay,
What is it?
and then I have one more scent that you have to check.
Okay. For some powder?
Do you know the scent?
Is it like garlic powder?
Yeah.
Oh.
I think a puff of one in your eyes.
Oh.
Sorry about that. Okay, so now that your eyes are all watery, I'm going to inspect your eyelids. Sorry. Your eyelids look symmetric. There's no lesions. Can you open them, please? There's no drainage. There's no crusting. So your eyelids are symmetric without lesions, draining, or crusting. I'm going to look at your eyelashes and your eyebrows. They're very nice and handsome. Your eyelashes and brows are symmetric with equal hair distribution. I'm going to look at your eyes, your sclers are both white. And then I'm going to have you kind of just pull down your lower lid a little. Thank you. Okay. Your conjunctiva are pink and moist bilaterally. And then I'm going to check cranial nerve 2. I'm going to pull up the smelling chart on my thing here. And I'm going to stand 20 feet away and I'm going to ask you to read line 9. For the sake of the video, I'm just going to go right here, 20 feet away. Can you read line number 9, please?
Line 9.
The very bottom.
L E F O D P C T.
Yep, and then I'm going to have you do the same thing, just cover your left eye.
Okay.
Okay, so with your right eye, read line 9.
L R F O D F C T.
Okay, so you got 2 wrong, so I would say your right eye is 20/25, and then I'm going to have you cover your right eye and do the same thing with your left. Read line 9, please.
Yeah. L E F O D P C T.
Great. Okay. So OD was 20/25. OS was 20/20, and OU was 20/20. Without glasses. Now what I'm going to do is I'm going to stand in front of you, and I'm going to cover my right eye, you're going to cover your left eye.
Okay.
And I just want to see if you can see your peripheral, so tell me when you can see it. Okay, how many fingers am I holding up?
3. 3. 2.
Okay, try doing it without looking.
Oh, okay. I'm sorry. I was supposed to look at it.
Look at my nose.
Yep.
Can you see?
Yep.
Okay, how many fingers?
1. 4.
Okay, you got all of those wrong. That's okay. And do your other. Can you see? Am I in your peripheral? Am I in your peripheral?
Yep.
Okay, how many?
1.
Okay, how many?
3.
Close. How about here?
2.
Okay, so you got one of them wrong. That's okay. So your peripheral is intact. Cranial nerve 2 optic is intact. Now I'm going to inspect the size of your pupils. So I'm going to have you just look straight ahead at me.
Oh god.
Just look. I'm not doing it. I'm just looking at the size of your pupil. It's a little dark in this room, but I'm going to say you're about like a 4 or a 5. Yeah, I'd say like a 4 or 5. Bilaterally. 4 or 5 millimeters bilaterally. They're both round, and then I'm going to just have you look at me. And,
Yep.
okay, so it's reactive to light, and then okay, they're both reactive to light. Sorry.
Oh.
And a combination perla. So cranial nerve 2, 4, and 6 are tested all at that same time. Now I'm going to inspect cranial nerve 4. I'm going to look at your ocular movements. So what I'm going to have you do is I'm going to have you just look at me and then look straight up and then come straight down. Awesome. And then I'm going to have you look this way. And follow my finger and then go this way. And then can you follow into your nose? Okay, great. And there's no nystagmus. And positive conversions, cranial nerve 3, ocular motor 4 and 6, and cranial nerve 7, abductans are intact. And then I'm going to go back to the cranial nerve. I'm going to check the trigeminal nerve, which is cranial nerve 5. So I'm going to use, I just cut the end of a Q-tip. So this ends the sharp end, this ends the soft end. I'm going to just go around a couple spots in your face and you tell me if it's hard, if it's soft, or if it's hard. So let me just test it in your hand first. Can you tell what side that is?
Hard.
Okay, and this one?
Soft.
Okay. So I'm going to do...
Hard.
Yep.
Soft. 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 Hard. Soft.
Okay. So sensations are intact, and then I'm going to just kind of put my fingers in front of your ears right here. I'm going to have you open your mouth and then shut your mouth, but wait until I touch.
Okay.
Okay, open and close. Okay. TMJ has no clicks or tenderness. Cranial nerve 5, the trigeminal, is intact. And then I'm going to check cranial nerve 7. We're gonna defer him eating anything, but you can taste sweet and salty. Okay, and then I'm gonna do, I'm gonna just look for symmetric features of your face. Can you smile for me? Can you turn to the camera so I can see? Can you smile? Can you frown? Can you raise your eyebrows? Can you puff your cheeks? Okay, great. So symmetric facial features, cranial nerve, 7 facial are intact. Now I'm gonna go to cranial nerve 8 acoustic. So I'm gonna have to stand kind of behind you.
Okay.
I'm gonna have you hold your left ear, just cover it.
Mailbox?
Yep. And then I'm gonna come to this side as well. Have you cover that ear.
Facebook.
Okay, great. The whisper test is intact. Cranial nerve 8 acoustic is intact. Now I'm gonna inspect your mouth. I'm checking cranial nerves 9, 10, and 11. So this I'm gonna have, we're deferring the sweet and salty taste. I'm gonna have you open your mouth, please. I'm just gonna use a light so I can see. I'm gonna have you open your mouth, stick out your tongue, and go ah. Okay. Great, and then look at me so I can see. Okay. Okay, and lift your tongue up. Okay, thank you. So there's equal rise of the soft palate and uvula. Can you swallow for me? Okay. Positive swallow and his voice is clear. His tongue was midline when I did that inspection. cranial nerve, 9 glossopharyngeal, 10 vagus, and 11 hypoglossal or intact. Now I'm gonna check cranial nerve, which one is this? 11. Which is the spinal accessory nerve. So what I'm gonna do is I'm gonna have you, can I stand in front of you?
Mm-hmm.
I'm gonna have you like resist up against my shoulders.
Okay.
So push against my shoulders. Okay, now push down. Okay, thank you.
Mm-hmm.
So equal strength cranial nerve for the spinal accessories intact. And then I'm gonna check the upper extremities. Can you put your hands up like this? And then can you quickly touch your all fingers to your tips of your, yep, just like that. Perfect. Fine motor movement is intact. And then I'm gonna check your resistance. So what I'm gonna have you do is I'm gonna have you just grab hold of my fingers and I'm gonna have you pull. And I'm gonna pull against you, okay? And then I'm gonna have you push me away and I'm gonna push back, okay? Good. So bilateral upper strength is a 5 out of 5. And then I'm gonna do the same with your legs. So I'm gonna have you push against my hands with your legs. And I'm gonna give resistance, okay? And then I'm gonna go behind your knees and pull them in. And I'm gonna give resistance, okay? So the lower extremity coordination is, oh, I'm sorry. Lower extremity strength is a 5 out of 5. Next, I'm going to have you walk. I'm just going to have you walk to the middle of the room, please. I'm going to check to see if you can do, yep, and then walk back. You have a smooth, fluid gait, no ataxia, and your ability to tandem walk, so a positive tandem walk. And then I'm going to have you put your left foot, the heel, I'm going to rub it against your right shin. Okay, that looks good. And then do the same with your other leg. Thank you. So fine motor movement and lower extremities are intact. You had a smooth, fluid gait, no ataxia. And then I have one more thing. I'm going to have you stand and face the camera so they can see. Okay, and then I'm going to have you make sure your heels are together.
Yep.
Your hands are by your side.
Can't really see.
Hands are by your side.
Yep.
And then I'm just going to have you close your eyes. Okay, you feel good?
Garlic powder?
Okay, you're all set.
Okay.
You can sit down. Alright. So negative Romberg, and then is there anything else I can get you before the doctor comes in?
No, thank you.
Alright, thank you.